For the anatomy, for MRCS part is very essential because if you are going to ace on anatomy, there is a high chance that you are going to pass this exam. Okay, so today we will demonstrate how to crack your anatomy for MRCS part A. Okay, in case of anatomy, what you need to do is you have to understand the questions first. Okay, so I want one of you guys to read the question, please, for me, and then we are going to discuss how to crack the answer. Anyone can read the question for me, please?
Yes,
Question one.
yes, I am
Go ahead, sir.
proceeding.
Yes, yes.
24-year-old man falls and sustains a fracture through his scaphoid bone. From which of the following areas does the scaphoid derive the majority of its blood supply? A.
Correct.
From its proximal.
Okay,
Yeah.
okay. Wait. Before you read the questions further A, B, C, D, E, what you need to do is you have to understand what is the basic question they have asked. Okay, so here they're asking about the blood supply, right? This is the blood supply they have asked, but for what? They have asked the blood supply for the scaphoid, correct? The scaphoid bone, right or wrong? So
Yes. Right.
this is the simple questions. There are simple questions that we're going to learn tonight, right? So what we need to know about the blood supply of the scaphoid. So now the way we did, the way we learn, okay, the way I have passed my part A back like in 2022. So the thing is now what we're going to learn these things in a 3D model. Okay, so for anatomy, we will try to teach these things in a 3D model. Okay, now tell me, in the hand, we have, as you can see, the bones, right, of the hand. So there are some proximal rows and some distal rows. And how many bones are there as a whole? Who can reply? Please, quick.
Total 8 bones.
Total 8 bones.
8 bones.
Okay. So now this is the patient's or a person's medial aspect or the lateral aspect, as you can see now
That
here.
will be the ulnar
This is
aspect or
ulnar
the.
aspect, right? And
Yeah.
this side is the
Or
lateral aspect.
is
Okay, so
radial aspect.
now exactly. So if you want to know about the orientations of the bones, so you can start from the proximal row, right? From proximal row, from lateral to medial. What are the bones we have? As you can see, this is the scaphoid, right? Next to it, what we have? We have the lunate. Next, what we have? We have the trichotrum. And then what we have? We have the pisiform. Okay, next thing, if you want to learn the distal row. So again, from medial, from lateral to medial, what are the bones we have? This is our trapezium, this is our trapezoid, this is our capitate, and this is our hamate. Clear? These 8 bones.
Yes.
Why I'm teaching this? Because there are different questions that what is the bone is located medial to the scaphoid. There is a different question. I will go for that. But now what we have to learn is basically the blood supply of the scaphoid, right? So let's see. Just always remember, to learn the anatomy, you need to have the complete visualization. Okay, then you are not going to forget in your exam. That's a promise from us. Okay, so now as you can see, this is the scaphoid bone, right? And what you are going to have, the scaphoid bone is going to have the blood supply from the radial artery, right? And basically these are having this from the superficial palmar branch. Okay, so now see, this is the distal part or the proximal part, guys? The scaphoid
That is the
bones,
distal part.
distal part. So see,
Distal.
as you can see clearly, the blood vessels are entering from the distal end, right? So now, if you're going to have a fracture at this place, what will happen to the proximal area? There will be a avascular necrosis, correct?
Yes.
Correct, okay. So we get to know about the blood supply of the scaphoid. Now, go and read the options.
A. A from its proximal medial border. B. From its proximal lateral border. C. From its proximal posterior surface. D. From the proximal end, or E. From the distal end.
Correct. So now we already know the blood supply is getting from what? The distal end, correct?
Yeah.
And all the other parts, they are saying it's from the proximal part. So what will be our answer?
It will be E from the distal end.
Correct. Is it clear? Will you forget again? Never, right?
No.
Because you
No.
have the complete visualization. Perfect. Everyone, get this clear? Except Mrityunjoy. Dr. Yusuf,
Yeah.
Dr. Tuhin, Dr. Reed, Dr. Lama. Is it clear for all of you guys? I hope yes. Okay, let's move on for the next one. Okay, Dr. Yusuf, can you read this question for me, please? Or anyone who is willing to learn, please. We are here to give you the idea.
Okay, so I'll proceed again.
Yeah, sure, no problem.
Which of the structures listed below are most likely related to the axillary nerve within the quadrangular space?
Perfect. Okay, so now what are the keywords here? We have to know. First of all, we have to know some of the structures where, especially in the quadrangular space, right? And the relation with what? In a relation with the axillary nerve. These are the keywords we have to know. So what we have to learn is the quadrangular space, right? So where basically the quadrangular space that we have to understand. So let's have a look, right? And it will be easier for all of you to understand. So as you can see, in this part, we are going to have a quadrangular space and also there is a triangular space, right? All of we know. So see here in this particular area, this is known as the quadrangular space, correct? So let's always remember to understand the one questions. If you go through the other specific or surrounding things, it will be easier for you to get the understanding. And also, if they're going to give you some other questions, it will be easier for you. So let's learn about the quadrangular space, the boundary of the quadrangular space and the content of the quadrangular space first, okay? So now, on the above of the quadrangular space, what is the muscle? What is this muscular structure we have? This is the teres minor, right? So the upper border will be formed by the inferior border of the teres minor, okay? Below this muscle is our teres major muscle. So the inferior border is formed by the upper border of the teres major, right? What is this one? This is our medial border, correct? So the medial border is formed by our long head of the triceps, and the lateral border is formed by the medial border of the neck of the what? This is what bone? Come on, guys. Humerus, correct. Now we have to learn the their contents, right? So basic contents here are basically two things. One is this is our axillary nerve, and the question was, along with the axillary nerve, what are the other structure is there, right? So as we can see, there is another vessel. This is an artery, as it is red. It is coming and is looping around the humerus, right? So what is this vessel? This is our posterior circumflex humeral artery. Clear about this one, everyone? About the boundary and the content of the quadrangular space, is it clear, not clear? Okay, so from here what you have to know, there are two triangular space, right? One is this and another one is this. So I'm not going to drag those things here, but for your exam you have to know, and in the course we will discuss about those things as well. Okay, so now go through and read the options and give me the correct answer. You have the correct answer here.
A is axillary artery, B is anterior circumflex humeral artery, C posterior circumflex humeral artery, D radial artery, E acromiothoracic artery.
Okay, so the correct answer is
posterior circumflex humeral artery.
Correct. Easy, just like drinking of water, right?
Yes.
Okay. Next question. Anyone else wants to read, or Mitundri wants to continue, please?
Yes, I'll read.
Go ahead, Dr. Reed. Good. I really appreciate everyone, because this is otherwise if you don't want to talk, you are not going to learn. Okay, Dr. Reed, go ahead.
Course
Very
of
nice.
median nerve. Course of median nerve relative to the brachial artery in upper arm.
Okay, so what we have to learn about the two things. One is the course of the median nerve related to the brachial artery, or they can switch the course. Okay, they can ask the course of the brachial artery in relation with the median nerve. Okay, so they can give you the both of the questions. So we have to learn both of those things. So the keywords is the course of what? Of the median nerve and the brachial artery, where? In the upper arm. So let's have a visualization then. It's very easy. Anatomy, you have to learn by visualization, right? As I'm saying. Okay. So as you can see here, in the upper arm, what is the relation we have to understand? For what, Dr. Reed? About
the median nerve and the
about the
brachial
median
artery.
nerve. Correct. About the median nerve. See, in the median nerve, in the upper arm, please, everyone, don't no voice. Everyone can. You cannot hear my voice. Everyone.
We can.
I can hear you.
Yeah, I think everyone can hear me. I think you have some problem. You can reset. Okay. This is the median nerve, right? Dr. Reed, this is the median nerve, right? So see,
Yes.
in relation with the brachial, this is our brachial artery, and in the upper arm, so this median nerve, it lies lateral or medial to the brachial artery. It is
Lateral.
lateral to the brachial artery. First, it is lateral. If we go down, then what you can see, it is coming on the anterior aspect, correct? See here,
Yes.
it is crossing and it is coming on the anterior aspect, correct? And then if you go down a little bit, then what you can see, it is going on the medial aspect of the brachial artery, correct or wrong?
Yes, correct.
So now, can we say the course in relation with the brachial artery, the median nerve, it lies lateral, then anterior, and then medial to the brachial artery, correct?
Yes. Yes.
Okay. If they are asking about the brachial artery, then what you are going to mention? First, medial, then posterior, then lateral, correct?
Yes.
Perfect. So now go and look at the question. Course of the median nerve related to the brachial artery. Which one is the correct answer then?
It lies lateral, then anterior, then medial.
Exactly.
Option E.
Any doubt? Any questions? No, right? This is easy. Anatomy is the easiest part for your MRCS, and you have to know this by your heart, and you need to have a complete visualization the way you can. Okay, good. Next, which one? Okay, who wants to read this question, please? Dr. Reed, you want to go? If you want, you can, no problem.
Which structure separates the cephalic vein and the brachial artery in the antecubital fossa?
Okay, so again, we have to learn first of all, the keywords. What is the question? The question is, we have to search for a structure which is separating the cephalic vein and the brachial artery. Okay, where in the especially the antecubital fossa. Okay, let's have a look then. So now I think we have to put some vein here. Let me put some vein. Okay, which one is the cephalic vein? I think this one. This one. This one is the cephalic vein. Okay, and we know which one is the brachial artery. This is the brachial artery, right? So can you tell me, Dr. Reed, what is the muscle lies here? What are the muscle lies here?
Biceps.
Yes, yes.
Biceps brachii.
Okay, see, this is the muscle, okay? The long head and there is a short head of the biceps brachii. So this muscle, basically, it is separating, as you can see, if I'm going to hide this muscle, okay? So now, as you can see, there is nothing in between. This is cephalic and this is our brachial artery, right? So the biceps brachii is separating our cephalic vein and the brachial artery, right or wrong?
Right.
Okay, so let's have a look at our questions and we want to see whether it is correct or wrong. Can we have our answer here?
Biceps muscle.
Okay, so your answer is correct. Clear? As easy as this. Okay, next question. Who wants to read?
Okay, I will proceed it.
Where? Dr. Lama.
Which of the following structures separates the ulnar artery from the median nerve?
Okay, and this is an interesting question because if, like, you know, you have to have a deep visualization for this. All right. So here, which one is the question is the ulnar artery and the, sorry, let me see the question
Median
again.
nerve.
The median nerve. Okay, so
Ulnar.
let me find the keywords. The following structure separates. So again, the same thing we have to see. from the ulnar artery and the median nerve. Okay, let's see what is the structure here. So let me first of all hide this one. Okay, and we have to search which one is our ulnar artery. So see, this is our ulnar artery because this is our brachial artery. From the brachial artery, we are going to have two divisions, right? One is the ulnar artery and another one is our radial artery, right? Okay, and this one is what? This nerve is our median nerve, correct? So now here, what is the structure that is going to separate this ulnar artery from the median nerve, right? Okay. So now this is a pronator teres muscle. Okay, what we need to do is simply we have to cut through it, okay, in order to see this separation. So let me just cut here. Okay, now can you see through this area here? There is
Yes, sir.
origin. This is the pronator teres, right? As you can, maybe you are thinking, okay, the median, this pronator teres, it is originating from where?
Medial epicondyle.
Medial epicondyle. Okay, okay, and also there is a origin from the medial aspect of the coronoid process of the ulna. This is this part, okay, and this part is basically doing this work of separation in between. This is the ulnar artery and this is the median nerve. So if I just simply, you can think we are going to separate the upper muscles, then it will not work. But we have a different origin, right? This origin will be connecting with this superficial one, and that's how they are going to be separated by this pronator teres muscle. Is it clear, everyone?
Yes.
Perfect. All right. So now go and search your answer, please.
So it's a pronator teres.
Exactly. As easy as this. Okay, let's move on for the next question. Go ahead, read the stem, please.
Which of the structure is not closely related to the brachial artery?
Okay, so our again, it's about the structures, and now they're asking not closely related. Okay, with what? With our brachial artery. So what we have to see, what are the things are closely related with our brachial artery, and then we have to move on and search our answers, the other answers. Okay, all right, so let's see if we can hide this muscle. Okay, so this is our brachial artery. Okay, so along with the brachial artery, what are the nerves we have? This is our median nerve, right? And
Yes.
on the sorry, okay, where I was showing, okay, I have shown you the median nerve. Okay, this is our median nerve. Okay, and also if we go above, then what we have here? We have this is our basilic vein. Okay, we have our ulnar nerve. Okay, and also there is an important muscle here. This is our long head of the triceps. Okay, so other structures, but we have to look for the options of the questions. What are the options we have? Ulnar nerve, median nerve, cephalic vein, long head of the triceps, median cubital vein. Okay, let me show you the medial cubital vein as well, then you will understand more. This is our medial cubital vein. Okay, so the medial cubital vein is not the answer, correct? This is not the answer. Okay, next thing is our this is our median nerve. Median nerve is also not the answer. Okay, ulnar nerve is also not the answer because it is on the posterior aspect. It is related with the brachial artery above, correct? Into these areas. Okay, also the long head of the triceps is also not the answer because it is also related with the brachial artery, correct? So what other options we had? The cephalic vein, right? So our answer should be the cephalic vein because the cephalic vein is this one, and the cephalic vein will be lying on the lateral aspect in respect of the brachial artery, correct, everyone?
Yes.
So what is our answer then here? The cephalic vein.
So it's
All the other structures are closely related with the brachial artery. Clear?
Yes.
Dr. Lama? Perfect. Okay, let's move on for the next question. Okay, remember in the very first place, I have told you the bones of the carpal bones, right? The proximal row and the distal row, from lateral to medial and from lateral to medial. So now, here is the question. See, read the question, anyone? Who have read the first one? Mitunjay, give this answer. Give me this answer, please.
Okay. Which of the following carpal bones is a sesamoid bone in the tendon of flexor carpi ulnaris? A.
Okay, see,
Triquetrum.
see, 1 second, please.
B.
1 second, Dr. Mitunjay, 1 second. See, the flexor carpi ulnaris. Okay, so let's find out which one is our flexor carpi ulnaris. And we will see underneath of this flexor carpi ulnaris which bones lies. Okay, so this is our flexor carpi ulnaris. Okay, and with for the frictions from this flexor carpi ulnaris, our which bone will develop? This is our pisiform. Is it clear?
Yes.
Okay, so see, you can see clearly this is our flexor carpi ulnaris, and because of the long-term friction, this bone, this tendinous part will become the bone. That's why it's known as the sesamoid, right? So now, give me the answer, Dr. Mitunjay.
It will be C. Pisiform bone.
Correct. Okay, very easy. Okay, now read this question. Dr.
A
Mitunjay, you can read this.
70-year-old a 70-year-old man falls and fractures his scaphoid bone. The fracture is displaced, and the decision is made to insert a screw to fix the fracture. Which of the following structure lies directly medial to the scaphoid?
Correct. So see, as I was saying, you're going to have a similar questions like this, right? Okay. So always remember, in anatomy, they are going to give you like some scenario. Maybe there is a history of trauma or something like that. But the main question will be in the last thing. Okay, in the last sentence, they're going to give you the exact question. So now tell me, remember the proximal row from lateral to medial. What are those?
It will be a scaphoid, lunate, triquetrum, and pisiform.
Correct. So your answer is structures lies directly medial to the scaphoid. Answer is
That will be B. Lunate.
exactly. This is a 10-second question. For whom have joined late, I'm just trying to show you the same thing again. So I have started this class with the carpal bones, okay? And in the carpal bones, we have the proximal row and we have the distal row. So from proximal row, from lateral to medial, what are the bones we have? This is our scaphoid. This is our lunate. This is our triquetrum, and this is our pisiform. Okay, distal row from lateral to medial, what we have? This is our trapezium. This is our trapezoid. This is our capitate, and this is our hamate. Okay, so be careful with these things, because in the part B you are going to have these things as well. Okay, and you have to know this by your heart from the front and also from the back, and I will teach you, of course, when you're going to pass the part A, in part B as well, and how to go through those things. All right, okay, let's move on for the next question. Who wants to read this? Hello, is my voice is clear for all of you? Hello, everyone. I cannot hear you properly.
There was some network issue, I think, and we
Okay,
cannot see your screen, Doctor, I think.
Okay, but you can hear my voice? Can everyone hear my voice? Okay. Just give me a second, and I want to just give me a second. I'm really sorry about the network issues here. Just give me a second. It will reappear soon, I guess. I hope. Okay, but see, everyone, is it understandable? The anatomy part, isn't it easy? Dr. Reed, Dr. Nitanjoy, Dr. Lama, isn't it easy? Okay, if you can hear me, please go and read the read the question, please. Who wants to read? Anyone? Go ahead, Dr. Lama, if you want to.
Okay. A 73 years old lady with a long-standing atrial fibrillation develops a cold and pulseless right arm. A brachial embolus is suspected and a brachial embolectomy is performed. Which of the following structures is at the greatest risk of injury during this procedure?
Okay. So you can, like, read. You can read the options first.
Okay, the first is a radial nerve, then second cephalic vein, then third ulnar nerve, then fourth is median nerve, and fifth is none of the above.
Okay, so see, first thing first, we have to know where exactly we are going to do the brachial embolectomy, right? So here,
Yes,
where we do the brachial embolectomy, in which vessel? Can you tell me? Do you know?
Brachial
Anyone know?
artery.
Brachial artery, exactly. And as we know, brachial artery is closely related with what? With what?
median nerve.
Median nerve, right? As you
Median
can
nerve.
see, here, right? So this is our brachial artery and this is our median nerve. So what is our answer here?
So
You
it's
get
a
this?
median nerve.
Median nerve, yes. Okay, all right. Next is, who can read this question, please?
I'll read.
Dr. Reed, go ahead.
A 23-year-old man falls and injures his hand. There are concerns that he may have a scaphoid fracture as there is tenderness in his anatomical snuff box on clinical examination. Which of the following forms the posterior border of this structure?
Exactly. So what we have to learn is basically the anatomical snub box, right? And always remember, in case of your MRCS, what you have to learn, the anatomical snub box, the boundaries and the contents and the clinical significance of this. Very, very important. Okay. So let's learn about the anatomical snub box. Okay. So in the anatomical snub box, what are those things that we have to learn? First of all, the boundaries. Okay. So this is the area. Can you see the model? Everyone, can you see?
Yes.
Yes, no? Okay. So these are some of the tendons, right? These are some of the tendons. Okay. So basically, what are the floor? How the floor will be formed? What you can see here? What you can see here? Some of the bones,
Scaphoid.
correct? Bones, yes.
Scaphoid.
This is a scaphoid, and also a part of this is what?
Styloid process
Radius.
radius.
Styloid process of the
Radius.
radius. Okay. Also, what are these structures, right? So we have to know which one is our lateral and which one is our medial. So this area is our medial aspect or lateral aspect, guys?
Lateral aspect.
Lateral aspect, and this area is our medial aspect, correct? So let's see what are the structures. So in our medial aspect, this is extensor pollicis longus, right? So the medial border is formed by the extensor pollicis longus. And on the lateral aspect, we have two things. One is the extensor pollicis brevis, and this is what? Abductor pollicis longus, the APL, and this is our EPV. APL and EPV on the lateral aspect, and EPL, the extensor pollicis longus, on the medial aspect. Is it clear?
Yes.
Perfect. Okay. So let's see if we can find which of the following forms the posterior border of this structure. Okay, what does it mean by the posterior border?
Is it a lateral?
Medial border.
Right, because when you are going to put this hand like this, Okay, this is the anatomical position of the hand, right? So normally this is our extensor pollicis brevis and abductor pollicis longus will be on the anterior aspect, correct? And
Yes.
this extensor pollicis longus will be on the posterior aspect, correct or wrong?
Correct.
So can we get our answer here? Which one is our answer?
E extensor
Extensor
pollicis longus.
pollicis longus.
Exactly, guys. Okay, so about the anatomy, I just thought about to go through the 10 questions for tonight. I'm really sorry. I should have give more, like maybe 20 questions so that you guys can enjoy more. And hopefully I will be doing these sort of anatomy lectures, some of the free, but normally what I do in part A and part B, I will try to cover all the questions of anatomy by showing you this 3D so that you will never forget in your exam again. And also it will be very much helpful for your part B because I'll be doing the same thing for anatomy. I'll be showing you these 3D models while learning the anatomy in part B as well. Okay, I hope all of you have enjoyed. Now Dr. Sanika will take the second part, okay, the clinical part, and hopefully he will start. Dr. Sanika, now everyone is yours. And I hope everyone enjoyed these 10 questions. Yes or no?
Yes. Yes.
I want some
Yes.
feedbacks.
Thoroughly
Okay.
enjoyed.
All right. Okay.
Thank
We will
you.
see. Okay. You again. Okay. Dr. Sanika, please continue.